Hi there, my name is Marla Neufeld, and welcome to the Surrogacy Space. I'm a reproductive attorney at Greenspoon Marder, and on the podcast today, we have Vivi Bitran with her company ATWOME. And Vivi, I'd just love to introduce you and give a little bit of background about what you do and what your company does.
Thank you so much for having me, Marla. Hi.
Hi, nice to officially see you here.
So yeah, my name is Vivi, born and raised in Miami Beach, and my background is as a nurse practitioner. I have a background as an ICU nurse and an inpatient nurse practitioner in plastic surgery.
Wow.
So I've always worked in pretty high acuity environments, but actually, my most meaningful, I think, not my most meaningful, but
Yeah,
some
very
of the most
meaningful.
meaningful experiences I've actually had in medicine is being on the other side as a patient. And that was sort of the impetus for joining ATWOME. I am head of clinical operations and community engagement with ATWOME.
Okay.
And I'm also a mom to two beautiful miracle boys. I have my son Elias, who's almost 5, and Julian, who is 1.5, both born through IVF.
Wow, well, congratulations on that. And
Yeah.
so you understand the ups and downs and trials and tribulations of IVF and needing some clinical intervention to build a family.
Yeah. So, a little background, I guess, for my fertility journey. I have It started when I was 22, which is quite young. My older sister got married young. She started trying to build a family, and was diagnosed with diminished ovarian reserve. Um,
Mm.
and that's when we both sort of realized that my paternal grandmother, actually, after she had my father, she was diagnosed with infertility and subsequently went into early menopause. Which
Wow.
back then, they really didn't have any explanations for or many treatment options. So she had my dad, and that was that. So when my sister was diagnosed, we sort of started feeling concerned that maybe there was like a genetic component. And although I was really young, I decided to seek care. So I went to a fertility doctor, and I did the whole workup, the labs, the ultrasound, and they really, with infertility, it's so hard because sometimes even if your labs are completely normal, you could still have infertility and, vice versa. So essentially what I was told is, your labs are normal, but on the low side of normal. And so we really can't predict, if or when you would, go have a diagnosis. So they
Right.
recommended I freeze my eggs, and I did. So I have
Wow.
done 2 egg freezing cycles, and then I actually met my husband, and we decided to do an embryo freezing cycle. We were only just engaged, so as an attorney,
Oh,
I'm sure you can tell me that that was risky.
yeah. Well, also, I mean, smart in a way, and just kind of like, let's get to the point here. We're going to make these babies and let's create some embryos.
Exactly.
Yeah.
And that's when when I did my first egg freezing cycle is when I actually got my true diagnosis, because I was 22 years old and they only retrieved 3 mature eggs,
Wow.
which is, quite low for that age. So that, sort of solidified my diagnosis of diminished ovarian reserve and essentially
Hmm.
unexplained infertility.
Right.
Um,
Well, thank goodness you had the foresight and you had the benefit of knowing of your family history to help be proactive. It must have made a huge difference in your, outcome.
yes and no. I still had some bumps along the way. And, ideally doing egg freezing and embryo freezing is an insurance policy. And I, still recommend it to people that want that. And, especially if they have a concern or a preemptive diagnosis. But in my case, unfortunately, because of my specific diagnosis, my eggs were really of poor quality. And so even my
Mm.
frozen eggs and my frozen embryos did not end up resulting in a healthy pregnancy. But I'm still grateful that I did it. And I still ended
Yeah.
up having to do a few more rounds of IVF to get pregnant with my first
Wow.
son. So it's
So
definitely been a crazy, crazy road.
yeah, but it's one of those things where you don't want to have the regret that you didn't, make that
100.
attempt. And well, if you
Yeah.
could explain to me what at home is, and it sounds like your personal experience must have definitely been shaped into this company and the benefit that it provides.
Yeah, so ATWOME is a company, high touch, at home fertility care. So we send nurses to people's homes to assist with fertility injections, first and foremost. We
Okay.
also offer medicine unboxing. So anyone who's familiar with the IVF, specifically the IVF process, you get this humongous box. You've spent thousands of dollars, and there's vials and needles and syringes, and especially, if you even if you're in the medical field, but especially if you're not, it's incredibly overwhelming. You're all of a sudden expected to just know how to reconstitute and mix meds and attach the
Yeah.
needles. So we send nurses to people's homes, and we help them unbox the medication, show them how to prepare them, how to store them, and if it's timed appropriately with their first injection, we actually do the first injection or walk them through the first injection, depending what their preference is at that time. And we
Wow.
also offer in-home lab work, so for cycle monitoring. So the stat labs
That's
that need
so
to be done.
cool.
Yeah, we coordinate with Unilab here, which most of the clinics use, and we have some relationships with other labs as well. So we can come and do the labs, and then we coordinate with the courier, and the labs will result the same day, just like as if you went to your clinic.
Oh, what a huge benefit. I know I went through infertility as well, years of IVF, and ultimately worked with a surrogate. And I absolutely remember getting that box of medicine and just having to figure out what everything is, what goes in the fridge, what doesn't. We had missing needles. And when you have a trigger shot, which is a very specific timed medication, if you don't have everything set up for that, your whole cycle could go down the toilet.
Yes.
I remember freaking out having to call pharmacy, trying to get an emergency certain size needle at night. It's just wow. So
My
that's
my heart's like beating fast for you right now.
yes, I remember this moment very well, freaking out about the trigger shot.
Yeah.
So, and I just didn't know that anything like this existed, at least when I went through this 12 years ago. So the fact that this is a resource now is hugely important because, I mean, I know the doctors at your IVF clinic can help and they draw the circle and there's videos, but I mean, most people have never done injections before this process. And now you're having to do them in your butt and your stomach, and it's a lot.
It's a lot, and it's already such an emotional process. And then you add the hormones into the mix, and we all, for those of us that have been there, it's really overwhelming. And I know for myself, when I was doing it, I was already a nurse. But I think I wasn't able to actually inject myself until probably like my eighth cycle.
Yeah,
That
I
far
mean,
into
just from a
it.
professional, I get that.
Yeah.
It's to do it on yourself is different than doing it on a patient, I
It's
presume.
really hard, and it's really scary. And when I started the process, I was single. And I
Mm.
remember I had to, call colleagues that I worked with in the hospital and beg them to come over
Please help me.
uh,
Yeah.
and help me. And, I had great colleagues that were willing to help, but I still had to, open up and tell them what I was going through. And I didn't want to share that with everyone, at the time. So it was, it was
Right.
hard to find the help and the support. And also being so young, like most of my friends were also in their 20s, and they were
Right.
like,
They
what
don't
are,
want to be giving shots and
yeah. So, the one thing I did
certainly.
forget to mention is that through all of this, I actually, my lifeline was my sister, my older sister. And I've actually watched a few of your episodes, and I know that you have a sister that you're close with as well.
Yes.
And so she had already been through it, or, was sort of going through
Okay.
it and had been through it. And I have so much gratitude for her, because through every step I would call her, she would walk me through it. She, helped me set my expectations. For some of the cycles, especially in the beginning, she couldn't be there to help me with the injections, but I had her on FaceTime, and
Oh, that's
it
so
was
nice.
so incredibly helpful. But it did make me realize, like, not everybody has this, not everyone has a support
Right.
person or someone that they can turn to that has been through it already. And so another um, side or a part of ATWOME, which is really what drew me to the company, is that beyond our clinical offerings, we actually have a WhatsApp group, a peer
Oh,
support
cool.
group. And we have members that are currently on a journey, and also members that have been on it, been through it before, who can kind of act
Nice.
as mentors and answer questions. And it's just a little something to try to give, other women a similar experience to what I had, like a sister holding their hand.
Yeah, because you never know. Like some people don't know, don't have the family support or don't know anyone going through it. So it sounds like it's like a nice, private, protected way to share your fears, anxieties, tips, things like that.
Yeah, exactly.
That's
Um,
such a great resource.
it's really incredible. And we've had some really good feedback from the women in the group. And as we grow, and we've already had a couple, we're trying to offer some programming and some events, both educational and also just a way to, have a night out with women in a similar experience as
Right.
they're going through. And maybe just decompress. It doesn't, we don't have to talk about it, but,
Right.
we had a flower making event where women got to, make flower bouquets at this beautiful flower shop in Boca.
Oh, very cool.
And we actually recently had a challah bake where
Nice.
we baked challah, and you didn't have to be of Jewish faith. It was open to all women, and we had an incredible fertility doctor from Boca join us, and she was there to answer
Mm.
questions.
Oh,
So
how cool.
we're gonna keep
Yeah, and
expanding.
I'm thinking of when I was going through IVF, I remember I had to be home by a certain time too. So I'm sure you all account for people's schedules and because I remember like certain things have to be certain times. So I always remember being like, all right, I can go to that event, but I have to be home by 6 for the shot and all that.
Yeah, yeah,
So
yeah. We try to time it, at a
convenient.
convenient time.
So
So,
what's your geographic range of where you provide services as of now?
so right now we're mostly in South Florida. So specifically, like South Miami area, all the way up to Palm Beach, and we
Okay.
are going to be expanding onto the West Coast, so Naples area.
Okay.
Um,
Great.
and our plan is just to continue expanding. So.
And so you mentioned you help with the first time shot. If there is a patient that needs more hand holding and help throughout all the injections, is that an option?
Yeah, so we meet patients or clients wherever they are in their journey. So
Okay.
whether it's the first time, we have some patients that want support throughout the entire process. So we do offer
Okay.
package options for some cost savings if you're going to commit to a certain amount of injections. And we do everything. So from the stimulations to the trigger and progesterone and oil. So,
Okay.
maybe you're just going through a transfer, you've already done the um, retrieval and now you're at a transfer point, but the progesterone and oil is like really intimidating. It's
Oh
obviously
yeah.
a lot
That
more.
was for me the worst.
Yeah. So we do progesterone and oil as well. Basically any and every injection. And it's not just for IVF, women going through IUI, egg freezing, embryo
Okay.
freezing cycles. We also help with um, people going through egg donation, both,
Yeah.
recipients and the donors, as well as surrogates. So intended parents
Yeah.
and surrogates as well.
And that's definitely something I was thinking of how this can help not just, the intended parent, but in third party reproduction. And I've seen some contracts where the parents will obviously pay for the help, the at-home help with the injections. This is a great resource to know if there's a nervous surrogate or egg donor that wants that help at home to contemplate this in the agreement to make sure it's covered and a covered expense.
Yeah, so we definitely can offer that. And something that we can offer in those scenarios as well, obviously with proper consent and medical release, is, for example, if the intended parent wants to get some documentation so it makes them feel more comfortable that they know, the injection was done, and also
Oh,
maybe they can
amazing.
feel a little bit more a part of the process. We can provide all of the documentation with appropriate, consent and release.
Right, of course, right,
Yeah.
HIPAA. But that's amazing because I mean, I definitely know in surrogacy, and egg donation, obviously, parents are just nervous. They're trusting another person and they're, want to make sure things are done properly. And I have unfortunately seen cycles be unsuccessful when the medicine wasn't done correctly, not intentionally, but it's complicated. So just to have those checks and balances is really, really helpful. I think it would create a lot of, give a lot of peace to everybody involved that the process is done correctly.
Yeah. So that is what that's what we feel as well. And so that's why we add that to our offerings. And also for patients. So on the flip side, patients just choosing to do this on their own, we can also provide them the documentation, the medical records, and we can provide it to their clinics as well. So
Okay.
we have a fully HIPAA compliant platform. The nurses
Okay.
document meticulously and in real time. And so we have like a full medical record that we can offer.
Oh, amazing. And what are some of the safety precautions? I know you said they're all registered nurses that help. So what are some other, just for any concerns on safety? And you mentioned privacy, that you're HIPAA compliant,
Sure.
for anything that might be concerned.
Yeah, so all of our
Sure.
nurses are registered nurses, and they're all BLS certified, so basic life support. They can initiate emergency protocols in an emergency situation. Hopefully that does not arise.
Right. Good to have though.
Yes, and they document in real time in a HIPAA compliant platform, and they follow an escalation protocol that we have. So, when they need to escalate to our medical director versus escalating to the patient's treating provider.
Okay, great. And just like the fact that all this can be done at home is so amazing, including some of the lab work. I mean, it's almost like you rarely have to leave your home these days. With food delivery and nurse delivery, it's like you never have to take off your slippers these days.
It's like Uber. Yeah.
Yes, that's related. The injection, Uber of injections, right?
Exactly.
Yeah.
Exactly.
And if you could just explain the name of the company and your logo, I think it's really cool, and to give a little background on that.
Sure. So, ATWOME, kind of a play on at home and the womb.
Yeah.
So that's, a little play on that. And our logo is actually the embryo. So splitting, as it progresses, goes from egg, fertilizes, and then goes through the splitting process to hopefully become a beautiful embryo for transfer.
For our listeners, Vivi's background is the logo, and you can see it's kind of like the dividing cells, which I think is really cool. And anyone going through this process is very familiar with that concept, and waiting for that 5 days or 3 days for the embryo to keep developing before you
Hopefully this is
can.
a grade A, or however your
Yes,
clinic grades it.
right, exactly. It's a perfect embryo.
Yes, yes.
Well, this is really cool. Your background in this, just professional background, your personal experience. I can tell you're so passionate about this. I mean, in fact, for our listeners, we were at a party and Vivi heard me talking about IVF or surrogacy, and she, I was really glad you did this. You introduced yourself and told me what you do, and only someone that's super passionate about this project would do something like that. So you can tell it's a really important service. I'm really so happy that we can share it with our listeners.
Yeah, sorry for that. Yeah, I'm sure you
No, I'm
you
so
wanted
glad
to
you
just
did
enjoy
that.
yourself at the party, and I'm like,
Not at all.
excuse me.
I'm so glad you stopped me. I mean, I changed my whole practice area to work in reproductive law based upon what I went through. So anyone that wants to talk about it or wants to share a resource, it is like a gift that I can give to share what you do with other people if it helps them. So I thank you for coming to me and sharing about ATWOME. So thank you.
Thank you so much. Yeah. I told you in the beginning, I was an ICU nurse, then I was inpatient plastic surgery nurse practitioner. So this is really a pivot for me. But even prior
Mm,
to doing this, professionally, I spent so much time, just passionately sharing my story on social media. Um,
awesome.
and
And that's
throughout
not
the
easy to
years,
do. I mean, it's scary putting yourself out there, but helpful, to
it
people.
is, but yeah, it's just, I always felt so good when people would call me and I can really just help them in any way. And I
Yeah.
really just did it to, again, I felt so fortunate that I had a sister that could help me, and not everyone has that. Um,
Yeah.
so it really is a passion of mine, and now I get to do it professionally. So
So great.
exciting.
What would be your parting advice for someone, a patient that just gets their first box, or they're thinking about starting IVF, and they're nervous about the medications? What's a good kind of tip, either professionally or personally, that you would like to share?
Um, It is incredibly, incredibly overwhelming. It's so scary. I have been there. And what I would say is, take a deep breath, as cliche as that sounds.
No, it's sure.
Find a song that's kind of your fight song. And,
Okay.
try to make a ritual of it. So I would, play the same song every night and try to pump myself up, kind of like a workout almost.
Rocky, like we're gonna do this.
Yeah, we are going to do this. And
Yeah,
that is, for me, that's what helped. But everyone's journey is different, and everyone, you can ask 10 people and 10 people will give you different advice. So you do just have to
right.
find what works for you. Maybe it's a walk,
Yeah.
Maybe it's a low impact, fertility safe, yoga or meditation, or maybe it's jumping around the house playing a loud song.
Yeah, whatever works for you. And like you said,
Yeah.
everyone has what works for someone might not work for the other, but finding that technique that helps you is, I think, hugely important.
Exactly.
And what would be the best way to contact ATWOME for the assistance that you provide?
Yeah, so you can call us 305-900-3640.
Okay.
You can send us an email together@atwome.com. You can go to
Okay.
our website, atwome.com. We have an Instagram @atwome fertility, and we're always there. Reach out anytime. We are happy to talk, answer any questions, and get you set up.
Thank you so much for your time, for sharing your personal story and the professional services that you offer with ATWOME. It's incredible. I'm so glad to learn more about it and share it with our listeners. So thank you, Vivi, so much for your time today. I really appreciate it.
Thank you so much, and be well. Good luck to anyone on their journey.
Thank you so much.
Bye.